Concussions have made headlines recently for the lasting impact they have on professional athletes. But what about the athletic kids in our families? Nora Dahman of Cass Regional Medical Center joins us this morning with more on what you need to know about concussions. Welcome to the show.
Thank you.
I think there is some confusion out there. What is a concussion?
Well, a concussion is a traumatic brain injury that is usually caused by some type of a blow or a blunt hit to the head, sometimes a fall, but I think of them as related to the hits that players can take in football games, any type of a blunt hit to the head or force to the head.
We say, got my bell rung, right?
Yeah,
got my bell rung.
Got my bell rung, that's right, yeah.
So is this common in lots of different sports? Are you seeing this in kids now?
It is, and we actually see concussions a little bit younger in kids because kids participate in sports at younger ages these days. So definitely, yeah, younger kids are at risk too. So
you're seeing girls and boys who are doing headers at soccer games and getting concussions. Is there like an immediate indication a concussion happened as opposed to oh, I have a headache?
Yeah, well, actually 21% of the concussions in the United States today occur from sports-related injuries. Most of them football, about 50%, and that's followed by soccer, and then basketball, but surprisingly more girls' concussions occur in soccer and basketball than boys, which is kind of surprising.
Wow.
But the symptoms can occur immediately. Usually within the first few days you may have symptoms of nausea, vomiting, dizziness, headaches, some impaired balance, maybe concentration and memory problems. But that doesn't necessarily mean that those are occurring within the first few days. Sometimes it's a little bit of a delayed reaction, especially if there is a hidden brain bleed, perhaps, that doesn't get discovered until maybe weeks or even a month later.
This is so scary. What can we do to prevent this from happening?
Well, concussions are accidents. They occur from accidents, so you can't always prevent them, but there are things that we can do to help prevent them. Number one is if you participate in a sport that has a high impact, such as football, good equipment, protective equipment. And the helmets they have today are so much better than the ones in the past, and I think that's kind of helping with that. But that awareness of symptoms and trying to prevent them from happening again, that second post-concussion syndrome, which is what we're really trying to prevent, and which is much more serious.
You brought in your brain, your own personal brain, and a few other brains.
I found my brain.
Show us what is happening and what part of the brain is normally affected with a concussion.
Okay, so if this represents a model of the brain, most concussions occur from head-on hits, okay? Especially when we're talking about soccer or football. When the brain is basically made up of soft tissue, okay, which is kind of cushioned by cerebral spinal fluid, and then you have this protective shell, the skull. So when you have an impact to the brain and it hits hard, the brain is soft, and so it moves. It kind of bounces around in this hard shell. So you get the impact from the force here, but the brain bounces against the back of the skull.
Oh.
So you don't just have symptoms perhaps that the front of the brain controls, but also the back, where your balance and vestibular system is. That's where you get a lot of those dizziness and vertigo and nausea and vomiting comes from the back of the brain. So it kind of hits and then bounces and hits and bounces again. So you can kind of get a variety of different
Wow, and I know that there, in terms of education, there are folks working really hard out there in schools to get awareness out there with the ImPACT program. So for more information and for other healthcare advice, go to cassregional.com. You can also call 816-380-3474. That was such great information. Thank you so much for being here, and something that I didn't realize.